Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Some residents of Edo State protest alleged forceful vaccination drive by government. Vaccination in Adamawa State threatened by floods in rural communities. And Australian health authorities warn COVID-19 hospitalizations will peak in October. The Nigeria Center for Disease Control, NCDC, has reported 93 deaths for the 29th of August, as well as 362 new confirmed cases in Nigeria. The NCDC says Lagos registered 79 deaths staggered over the past days from COVID-19 complications, while the rest of the 14 deaths are from across all other states, which adds up to the death toll, which currently stands at 2,454. Till date, the confirmed case numbers edges close to 200,000, as over 2.7 million tests have been conducted in the country. Let's take a look at the update.
The latest data from the Nigeria Center for Disease Control shows that the daily COVID-19 infections in the last 24 hours are at 362, amidst the spread of the Delta variant in the country. The latest figures were reported from 14 states and the FCT, indicating a drop from the figures reported earlier. Lagos topped the chart with 200 cases, followed by Oyo with 33 infections. 30 cases were recorded in Kwara, 24 cases were reported in Akwa Ibom. Ogun had 17 cases, while Delta and Ekiti states had 15 cases each. 7 cases were registered in Plateau and River State. 5 cases were reported in the FCT. Anambra and Edo reported 3 each, while Bayelsa, Kaduna, and Kanu registered 1 case each. There were 0 cases reported from Nasarawa, Ondo, Osun, and Sokoto states. The latest update also includes a backlog of deaths from Lagos State and cases reported from Delta. The overall count of confirmed cases in Nigeria now stands at 191,345. 236 people have been discharged in the last 24 hours, increasing the total number of recoveries to 178,283. The NCDC also reported 93 additional deaths from COVID-19 complications in the last 24 hours, raising the fatality toll to 2,454. Presently, there are more than 10,000 active cases in Nigeria, while over 2.7 million samples have been tested so far. In Africa, there are more than 7.7 million confirmed cases, and over 194,000 deaths have been recorded across countries on the continent. The total global confirmed cases have now surpassed 216 million, while more than 4.5 million deaths have been reported.
The recent proclamation from the governor of Edo State, Mr. Godwin Obaseki, that access to some public places and mass gathering would be dependent on COVID-19 vaccination status from the second week of September has received stiff opposition from a group of protesters. Made up of members of various civil society organizations, they took their message to the Nigerian Bar Association, the Nigeria Union of Journalists Secretariat, where they were also at the Edo State Government House, all in Benin City, the state capital, demanding that the governor rescind the decision before the end of this Friday. Our correspondent Jessica Lubishere reports.
The protesters wait outside the Edo State Government House as they have demands to present to Governor Godwin Obaseki. The chants, as well as the banners, states their mission. Eventually, the chief of staff to the governor leads an entourage to them and listens to their demands.
So, Your Excellency, the representative of the Edo State government, we have come here with one particular demand, that Governor Obaseki must resign his decision. True. That decision will not stand. Yes. The Christian Association of Nigeria took a position. Can CAN does not represent our interests. There are more than 2,000 churches that are not under CAN in Edo State. CAN cannot represent the Islamic Society of Edo State. No.
Mr. Osadolo Oche, a cleric and a civil rights activist, maintains that the protest is not against the right of other persons to be vaccinated.
We are not against anybody that wants to accept vaccination. Let's make this very clear. It's a choice matter. Just like the governor has no constitutional right to also force us to take vaccination.
The Chief of Staff to the Edo State Governor, Mr. Osaigbo Voiyuha, responds to the group.
We have heard what you have said, and I would like to receive your petition, if it's here now, so that forward transmission to His Excellency. Thank you very much.
The protesters thereafter dispersed upon reiterating their plan to return on Friday, should their demands remain unattended to. Jessica Olubuse, Channels Television News.
Well, staying in Edo State, residents have been urged to make the most of the COVID-19 vaccination window to receive their jabs and get protected from the virus. The advice is coming from some clergymen as the state's COVID-19 response team carried out vaccination in some churches in the state capital. A pastor from the Redeemed Christian Church of God and APC gubernatorial candidate in the September 19, 2020 Edo governorship election, Osaye Ezeyamu, and the parish priest of St. Peter's Catholic Church, Reverend Father Stephen Okoje, said the vaccine is safe, encouraging residents to do so.
We should not allow rumors and ignorance to deprive us of the opportunity of getting this thing. We all know what we suffered during the lockdown. You can see abroad now they are opening up. They are opening up because most of the people have become vaccinated. So let's not allow a situation where the thing now begins to go up again in high numbers, and we're now forced again to lockdown, and there's hunger in the land. So I think that it's a good thing. I took it, and there really was no side effects.
We now pray that we should have a vaccine to help with this matter, and thank God we have a vaccine now. So we want more people to be vaccinated. There is no myth about it. Even while we're growing up, we took different kinds of vaccines. So I don't see any reason why it should be an issue for somebody not to take vaccine against COVID-19. I am fully vaccinated, and almost 60% of my parishioners here have been vaccinated.
And from the south to the north in Adamawa State, they've received over 70,000 Moderna COVID-19 vaccine doses for the second rollout in the state. According to the chairman, Adamawa State Primary Healthcare Development Agency, Dr. Bashir Sulaiman, the vaccines are stored in a favorable condition and are now being administered to citizens. He also speaks further on the vaccine hesitancy and the Delta variant.
Phase of the vaccination exercise in Adamawa State has picked up pace with the inoculation of over 5,000 people so far. The leader of the vaccination team at the Yola Specialist Hospital, which serves as one of the vaccination centers, describes the turnout as impressive.
It's around 8:30. The turnout was good. People are coming out. We have already finished one bottle. Inside one bottle are 14 inside. We are going to open the second one bit.
The executive chairman of the State Primary Healthcare Development Agency says remarkable progress on strategies to flatten the curve has been including the training of health workers on COVID-19 prevention and control.
Well, we began community social mobilization in earnest to prepare the people in Adamawa State for these vaccines, and we are beginning to see a reasonable result. We train health workers from the state to the LGA to even the field workers, the vaccination teams. So we are fully prepared now, and when we flagged it up on Monday, 23rd of August, we integrated it with the Maternal, Newborn and Child Health Week because we are providing all the services provided in the primary health care settings.
Despite these successes, heavy rainfall, which has led to flooding in rural communities, has made it difficult for people to gain access to the vaccines.
I must commend that we've been able to achieve quite a lot. We've vaccinated almost 5,000 plus within these few days. But we are also working under difficult condition because it's in the rainy season. The movement of our team is significantly constrained by the heavy rainfall, and that is why they cannot move freely to the other places when it is raining, and even clients cannot come to the facility when it's raining.
While the state government says it is working to enhance their capacity for a successful rollout, disruptions to vaccine delivery in the flood-affected areas should be mitigated to meet the healthcare challenges that people in rural areas experience.
While COVID-19 pandemic remains a leading challenge across the globe, what role can good nutrition or lifestyle changes play in fighting against the virus? We have joining us Dr. Folu Olatono. She's a consultant, public health physician and nutritionist, College of Medicine, University of Lagos. She joins us virtually on the program. Thank you for joining us.
You're welcome.
Thanks again. Now, with low vaccinations taking place in Africa, low infections compared to other regions, how would you assess what might be responsible for, some would call it our fortune, if, you know, I can call that it that. Does it have anything to do with what we eat, our skin type, our environment? What exactly?
I think the first thing we need to take note of is the fact that there's low testing rates in Africa. We're not getting tested like other parts of the world. Apart from that, we have a young population. The people that COVID-19 vaccine affects more are the elderly people. In the Western world, these elderly people are more in number compared to the number that we have in Africa. So here we have a young population, so much that the median age in this part of the world, especially in Nigeria at this time, is about 19. And this set of people are not really affected by COVID-19 like the elderly people. Moreover, the climate here is hotter than in the temperate region, and science has proved through research that the temperature, the low temperature is favorable for the spread of COVID-19 vaccine. So we can say from the climate, that's our environment, we tend to be more fortunate because the temperature here does not really favor the transmission of this disease. Apart from these 3 points that I've mentioned, we have really instituted a lot of public health measures. A lot of health education has been going on since the beginning of the pandemic. The community health systems in this environment have also been more effective than imagined, even though we have low resources. Our health resources are not as much as in the other parts of the world, but we have good community health systems whereby we quickly isolate those who are infected. Contact tracing takes place, and these people are quarantined and the infection is checked. The mortality rate is also lower because of the young population that I mentioned earlier on. Since the people that are affected, that really get down.
Sorry to cut in, and this is if you can hear me. How true is the saying that a proper diet can ensure that the body is in a proper state to defeat COVID-19?
Yeah, it's really true because diet improves immunity. So when people eat right, they eat a lot of fruits and vegetables, they get enough micronutrients from the fruits and vegetables in terms of the amount of vitamins and minerals that are available from them. Their immune system gets strengthened and they are able to fight diseases, whether COVID-19 or any other infection or even non-communicable diseases. When the immunity is in top shape, the diseases can be fought with ease compared with people whose immunity is very low. So I can say that that statement is true, that the body is in a proper state to defeat COVID-19 if immunity is high. But please note that nutrition cannot prevent COVID-19 and cannot cure COVID-19. It can just strengthen the body, strengthen the immune system to be able to fight the disease.
Finally, if you can tell us, many Africans talk about relying on herbs. We also hear things like taking a lot of ginger, alligator pepper, garlic. There's so many things we've heard that it sort of prevented them from getting COVID. It really improved their immune system. What do you think of these theories, briefly?
These theories have a little advantage, or we can say they're true to an extent. But like I said earlier on, please note that these substances cannot prevent or cure COVID-19, but they can do a lot to strengthen the immune system. Herbs, garlic, onion, ginger contain a lot of antioxidants, and these antioxidants can mop off free radicals from the body, thereby strengthening the body, making the body to be healthier. Apart from that, these substances are alkaline in nature. They alkalinize the body, and when the body is in an alkaline state, the body is able to fight infections better. But if the body is acidic, then it's easy for the body to succumb to infection. So anybody who feeds well, eats the right kind of food, a lot of fruits and vegetables, take legumes to get protein, animal products in moderate amount, is able to get enough protein, is able to build the immune system, and the immune system is functioning properly, that person will be able to fight diseases. But those who indulge in unhealthy diets,
essentially, bottom line is proper nutrition, strengthens the immune system, doesn't cure COVID-19.
Yes.
Thank you. We appreciate your time on the program. We'd like to have you join us again, but thank you for today. Dr. Folu Olatona is a consultant public health physician and nutritionist, College of Medicine, University of Lagos. Thanks again.
You're welcome.
Still ahead on the program, Jigawa Polytechnic vows to dismiss students or staff violating COVID protocols. Please join us again. Welcome back. The management of Jigawa State Polytechnic has vowed to dismiss any students or staff found violating the COVID-19 protocols. The registrar of the institution, Alhaji Ilyasu Hussaini, disclosed this in an interview with Channels Television in Dutse, the state capital. Our correspondent Sadiq Ilyasu has more.
Since the outbreak of the COVID-19 pandemic, schools in Jigawa State were temporarily shut down as part of measures to control the spread of the virus. With the reopening of schools in the state, things have now changed from the norm, as students of the Jigawa State Polytechnic seem to be adapting to the new normal. A hand-washing facility is installed at the different entrances into the school, students wearing their face masks and social distancing observed in the classrooms.
Because they told us that if we are entering, we should come with face masks. If not so, they will drive you back home. You will not enter the school again. And before we enter, we'll wash our hands with sanitizer before you enter. They drop a bit of rubber and hand sanitizer there with soap. Before you enter, you wash your hand before entering the
instruction that they are telling us to do is to put our face mask, wash our hands with sanitizer, and the rest of the others.
While the management of the institution says it has implemented a range of control measures to reduce the risk of exposure and spread of the virus, they announce sanctions for anyone that violates any of the safety precautions.
Well, you know that COVID-19 is real. Whether people like it or not, COVID-19 is real. And as such, if you violate our rules and regulations, if you violate the protocols, being laid down by the COVID-19 committee, definitely will send you out of the institution if you are a student. If you are a staff, we are going to send you to the disciplinary committee and they will take disciplinary measure against you.
With Nigeria experiencing a third wave of the COVID-19 pandemic, adherence to COVID-19 safety protocols remains the basis for the pandemic response. Sadiq Ilyasu, Channels Television News.
And away from Nigeria, in July, the Ghanaian government tightened restrictions following the rise in COVID-19 cases. This is as a result of the detection of the Delta variant as it entered its third wave. But right now, what are the current efforts in the country to stem the spread? Joining us, Dr. Samuel Ofori Ajekum is a medical practitioner. He joins us from Accra, Ghana. Thank you for joining us on the program. Dr. Jekum, if you can hear me, welcome again. Initially, there were restrictions on funerals as well as weddings. Has that been lifted? Dr. Jakum, please unmute. All right, we'll try to get a hold of the doctor much later. But let's tell you what's happening elsewhere around the globe. The World Health Organization, WHO, has warned a spike in coronavirus infections and a slump in vaccination uptake is holding back Europe's efforts to curb the pandemic. Now, WHO's Europe Director Hans Kluge said a recent increase in COVID-19 cases and deaths was deeply worrying. He blamed the more infectious Delta variants, the easing of restrictions, and summer travel. He predicted that Europe could record another 236,000 deaths by December. Here's more.
Australian health authorities predict October will be the worst month for intensive care hospitalizations and pressure on the health system near the epicenter of COVID-19 cases. New South Wales Premier Berejiklian said on Monday, Australia's most populous state on Monday reported a record one-day rise in new COVID-19 cases of 1,290 infections as the nation struggles to contain the highly infectious Delta variant. Berejiklian says the state was preparing for additional hospitalizations as infection cases accumulate before increased vaccination coverage start to ease the pressure. The state reported 4 additional fatalities on Monday, taking the total death toll from COVID-19 to 1,003. Making it the last of the group of 20 big economies to exceed the grim milestone. On Sunday, Israel began offering a COVID-19 booster to children as young as 12. Its prime minister says a campaign that began a month ago among seniors has slowed the rise in severe illnesses caused by the Delta variant. Announcing the decision, top Israeli health officials said the effectiveness of the second dose of Pfizer-BioNTech vaccine waned 6 months after administration, making a booster necessary. Head of Public Health at Israel's Health Ministry, Sharon Alrod-Prez, stated that the third dose should bring people to the level of protection achieved by the second dose when it was fresh, and this will mean people are 10 times more protected after the booster. New Zealand reported first recorded death linked to U.S. drug maker Pfizer's COVID-19 vaccine. After a woman suffered a rare side effect leading to inflammation of the heart muscle, the report follows a review by an independent panel monitoring the safety of the vaccines. The panel attributed the death to myocarditis, a rare but known side effect of the Pfizer vaccine. The health ministry says other medical issues at the same time could have influenced the outcome of after vaccination. But the vaccine's benefit outstripped risk from side effects. This comes in after the country battled an outbreak of the Delta variant after nearly 6 months of being virus-free. Scottish First Minister Nicola Sturgeon says she was self-isolating on Monday, having received notification that she had been in contact with someone who had tested positive for COVID-19. Sturgeon posted a message on social media platforms saying she would be self-isolating pending a PCR test result in line with the rules. She also thanked the contact tracers working in NHS Test and Protect. According to local media, Scotland's National Clinical Director, Professor Jason Leach, has reported the First Minister is symptom-free.
Medical practitioner Dr. Samuel Ofori-Ajekum has since joined us. Thanks again, Doctor. Hoping you can hear me. Tell us more about the containment measures in Ghana.
Well, thanks for having me, and sorry for the earlier mishap. Yes, so in Ghana, the containment measures put in place are really not quite different from what we have in other countries. On the side of the public, the government recently introduced what they call a peer-to-peer compliance mechanism, where each citizen is encouraged as much as possible to push the other person, his neighbor, his co-worker, the passenger boarding a public transport, to put on their mask, aside the fact that it is mandatory for people to put on masks when they go to any public places and all that. Secondly, mass gatherings have been reduced, although not banned outrightly. There have been a massive reduction in the numbers allowed for mass gatherings like weddings, funerals, and programs like that. All the safety measures and the protocols are also in place, as we know, hand washing, wearing of masks, as I said earlier. That is on the side of the populace and the citizenry. On the side of the government, efforts have been revamped to increase contact tracing for anybody who tests positive for coronavirus in Ghana. People who are arriving in the country are tested at the airports. They do a rapid antigen test, and confirmatory PCR tests are done for those who test positive and are put into quarantine. So the quarantine measures have been increased. A lot of hotels and guest houses and people in the tourism industry have been co-opted to support the government to contain these people who are entering the country, especially to prevent the spread of the new Delta variants.
Dr. Gekum, finally, and this is in a few seconds if you can, vaccination, how is that ongoing?
Vaccination is also ongoing. Already there were some vaccinations. We started with the COVAX program, under which we received the AstraZeneca vaccine. So those who had their first dose of the vaccine, they are there, and starting from tomorrow, the 31st of August, until the 4th of September, they are going to receive the second dose of the AstraZeneca vaccine. Others have also received single-dose vaccines like the Sputnik vaccine and the Johnson & Johnson vaccines. We had 122,000 doses given out to people, even though the government was expecting at the time to be able to vaccinate up to 13 million people. But I think probably due to global logistical constraints on the supply chain of coronavirus vaccines, that hasn't materialized. But nonetheless, a lot of people have been vaccinated, and vaccination is still ongoing.
Something that Africa is going through, and lower-income countries. We'd like to appreciate your time. Thank you so much, Dr. Samuel Ofori-Ajoku, medical practitioner. Thanks for joining us.
Thanks for having me, and hope to join you some other time. Thank you.
All right. Well, for more updates, take a look at our website. It has the latest on the pandemic and several other news breaking stories at your fingertips. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Wonwoka. Stay healthy.